Good morning, everyone. A warm welcome to you all. I, on behalf of Department of Health and Family Welfare, and on behalf of Momentum Routine Immunization Transformation and Equity Project, a USAID-funded project, welcome you all. Okay, this media conference aims to contribute in improved reporting on IMI 5.0. IMI is Intensified Mission Indradhanush 5.0. We also expect to highlight key activities being carried out in the state. One key expectation is like positive stories from the 3 rounds that we will be having, August round, September and October round. There will be 3 rounds. So we expect positive stories to be disseminated through your media platform. And number 2, highlighting the role of community champions. And number 3, all the risk communication that is associated. We also expect you all to disseminate. And 4 is countering misinformation and disinformation. So these are some of the key expectations that we are expecting from you all.
This mission Indradhanush started in December of 2014. And in 2017, it became Intensified Mission Indradhanush. Now, this is going all over the country. Before, what we used to do was, we used to be very selective. Those districts, Tahan Kundu district performance biya ase, Kundu districts immunization coverage ekdom low ase. Itu khamde aman emphasize kurigina kuri daga ase. But from now on, from this mission Indradhanush 5.0, we will be concentrating on all the districts. That is one change. Second though, this time mission Indradhanush kile gule bishi special olai jado, like iman din bra kuri ase from so many days kuri ase, kintu this time though we are going to go digital. Okay, as part of the Digital India platform. Aman Nagaland dibi aman digital jawle ase. Aman last year October November bra we started having a pilot project in Peren and Dimapur. Itu pilot project to October bra aman practice kuri gina January bra live te jaise digital kurugule. That means digital in a sense means your appointment, your session, your due site, aro itia apni ham immunization card, you can now generate yourself through your mobile phone. Okay, so paperwork will be less and no need of running around for your immunization certificate. Even for the ladies who are pregnant, they can generate the immunization certificate because now most of this immunization certificate they are required in many schools. Then for pregnant women also they are required for some subsidies, and there are many reasons why this certificate is needed. So now the government of India has made it like no more running around for this certificate. You can generate your own certificate after you get vaccinated. So pilot project to aman January de life jaise ininga jaigina, that is 65 district in India de aman January bra life jaise as a pilot project. Now from this month August 7 bra IMI de aman all 700 districts India de aman life jabule ase. That is the sort of a task we have been made. Now tade apni ham press lagado, especially your role is very important, and especially because like during the COVID time we had a lot of problems because of fake news and fake this and that. Then people started coming up with lots of funny ideas. So the press plays a very big role, giving out the right information and then giving out the facts, and then also encouraging the people and encouraging the health workers and all that, like the work they are doing, also some positive comments, and the coverage you all give, that is going to play a very big role. Our state is a small state. We don't have very high amount of children and pregnant women, but it is now becoming more difficult for us because our coverage in 2016-17, our immunization coverage was just around 30%. Now, as for the National Family Health Survey, 4 and 5, we have steadily increased to around 60%. That is as per the 2011 census. But আমি আমি সব জানি 2011 census তো অলপ problem আছে, অলপ high side there আছে. তো আমান what we have done is we have started going for a head count from all the places. Okay, the exact head count in the village. Naga style, you get yourself registered in the village, but you live in Dimapur and Kohima. That is what it's going on. Na? Postide, vote divo, postide, naam divo, sab divo, but your actual resident is in Kohima and Dimapur. Now, because of that, we have been having a lot of, census law and problem. That is why we have gone for the head count. Now we want to know the exact number of children and pregnant women in the village, in the urban areas, in the towns and cities like that, so that our targets can be set. And also the vaccine distribution will be much better. So itula hisabte head count bhi we are nearly finishing. It's not perfect, but that will give us a good indicator of what is the targets to be achieved. Our head count na sa hisabte we are doing quite well. In fact, aman census laga hisabte 60% ase koile bhi head count we are doing very well. We are reaching nearly 90%. So of our target population of children and pregnant women come those activities to be. So in that case, what has happened now is aman we have come to the last mile. Now last mile we have found out like many of the people who are not coming are because of awareness problem. Najane why we have to get vaccinated. One, the advantages been najane. Second, though, like false news or false kahan message come power, they are very reluctant. They are resistant to it, and then some people though they are least bothered actually. So our job is now not only to vaccinate, but to make awareness, to tell the people that the advantages and the good things that will happen if you get vaccinated, and in the long run, the health of the person matters a lot from childhood. So that is why this time this intensified mission Indra Dhanush 50, this is important because we are going in all the districts in the state and as well as in the country, and we will be using the digital pathway, Digital India system.
For Momentum Routine Immunization, Transformation and Equity, which is a project being implemented by Johnson of India, funded by USAID across 18 states in the country. And we are very thankful to the government of Nagaland, the state government and the team present here for supporting the project. And through this support, I think we've been able to work within the communities, especially I think our work with COVID-19 vaccination, that's what we started almost about 2 years back. And we worked in 10 districts of the state, trying to mobilize community, clarifying myths, dispelling rumors if there were any, mobilizing, bringing in that sense of urgency and community engagement to get vaccinated. And I think in the history of at least of the last 3 to 4 generations that we've seen, I think first time adult vaccination was being done. It was very new for me, for you, for all of us present in the room. People to take vaccination after being an adult also now. But thanks for this entire participation by multiple stakeholders, by the state government, by the media, by the community, by development partners and many others, all these partnerships. I think the state has really gathered very strong numbers. Also, I think our work with the faith-based leaders, that's a new group that emerged. And some of you might have known, there is the Sunday strategy vaccination meetings that happened, wherein during the congregations, the key messages for vaccination, key messages for protecting your community, bringing in that sense of community participation was brought in, which was taken up very strongly. I think more than 10,000 beneficiaries were vaccinated through this strategy alone. So innovative projects being done at district level, interventions being designed to suit the local needs and requirements. That was what the key was all about with COVID vaccination. No one size could fit all. I think that's my takeaway. What worked in one district might not be very strongly resonating with the second district. So how do you really course correct? How do you reiterate sitting in that project in that district? I think that was important. That's what the partners have done. And this was quite strongly supported by media. Thank you for your very strong role in communicating the right stories. We knew COVID-19 came, there was so much of dismay that happened. There was a lot of, we all went through it. We lost a lot of people and friends and many lives that we know. But what was important was for the state and for the country was to come back out of it. And vaccination was the strongest tool that we could leverage. Taking vaccine to each and every person to the last mile, delivering to that point was very important. That's what the project and many other partners, our subawardi NGOs have done here. So that is one strong takeaway. Also, I think now with IMI 5 coming, with all the more effort and push nationally, earlier we would have it in zones and only with the breakouts or outbreaks have been. But this time it's national, it's happening in 3 rounds, it's a push that we all are coming together. Nagaland has a good fair share, the numbers are very good, unlike many other states. So this is one strong point. And from media, I think we see a very strong catalytic role that media can play, driving the positive messages, bringing out those stories that promote vaccination. We see a lot of vaccine hesitancy in many pockets. So a lot of interpersonal communication work will be required, which the partners and projects and sub-awardees will be doing. But what media can bridge the gap, nobody else can do. Spreading the right message to a larger audience, that is what the power is there with you. Power to create awareness with fact-based messaging. If there's a rumor or a myth that's prevailing in a community, an immediate, positive story can turn that rumor around. You can promote the caregivers, the mothers, to come and get their kids vaccinated. The families need to be engaged. The larger groups need to come be a part of it. Community influencers at the level of community, at the districts, if they can join forces, or if you can create champions from them who can advocate for the cause, will be very important. So this is one step, this conference, to share what all government is doing, and this lot that the government is doing. Digitizing this with the population size of our country is no mean task. Of a population of 130 crores and getting a digital application to get kids enlisted into it, figure out when is the next vaccination. It is a mammoth task and government is endeavoring to it. All that we require is the support of the partners, of our allies like the media here, multi-stakeholders, to come together and make this a success. Make it adoptable, make it possible, what is going to probably solve a lot of problems as we go ahead.
So I'll just be giving an overview of the IMI program, for which we are having this media sensitization workshop today. So as our SIO had mentioned, that this is not the first time that we are having intensified Mission Indradhanush. It's been many years, it's around 8 years with several rounds, and these dates and strategies are decided by the ministry. Because even if we have been having this routine immunization program since the 80s, our country still has this challenge of not being able to reach each and every child. So this is one of the strategies. This is an intensified immunization drive to reach out to all left outs and dropouts of children as well as pregnant women, because we cover the pregnant woman also under routine immunization. So for this, the health department has already completed all the planning part of the program, like the headcount activity is more or less complete in all the districts. Now, like the due list of beneficiaries, that is also in the process, and basically the micro planning process is in ongoing right now. So what we need this type of workshop is that the planning part, the health department will take care of it, but spreading out the awareness and to create a demand for vaccination, that is where we need the support of other stakeholders. So in addition to these type of sensitization workshops, all the districts they are also conducting district task force meetings, which I'm sure many of you have come across in the papers and in the media. So that is also one of the platforms where the health department reaches out to the other key stakeholders, namely the ICDS departments, education, the NSLRM. So it is through the help of all these other allied departments where we can increase the mobilization efforts for vaccination. So under the planning process of Mission Indradhanush, it includes good quality headcount and micro-planning. And as our state immunization officer had mentioned, this time it is going to be different because it's going to be digital. So we will be using this UN app, which Kingston will be talking more in detail about that. So for that also we need awareness, because you are aware that during COVID vaccination, everyone had to use their mobile numbers to get registered. So now since we're just starting out on UN, maybe that self-registration may not start, but the plan or the strategy of the ministry is that after IMI, for this ongoing routine immunization, it will all be come under UN. So you, me, every one of us, if we have small children, we have the option of registering by ourselves. So for that, that awareness needs to be created, just like how it was done for COVID. So the overall goal, the immunization agenda is to reach every zero-dose child. That is the agenda for our country. And also, side by side, our country is committed to achieving measles rubella elimination by this year. So for that, we need to have a good vaccination coverage for measles and rubella vaccine, which comes under immunization program. So it is this IMI 5.0, it is a program which we will leverage in order to achieve the MR elimination goal. So this time, the target beneficiaries for IMI are going to be children between 0 to 5 years of age. Earlier it was, all the other rounds we had previously was 0 to 2 years. This time it's 0 to 5 years, so that we can catch hold of all the children who have missed out on MR vaccines, and they should be vaccinated so that we can achieve the MR elimination goal. So in order to make this program a successful program, and for us to increase our coverage, immunization coverage, we need to have good convergence with other allied departments and any other agencies that can help us to spread the awareness about importance of vaccination. And those parents who have either not vaccinated or just partially vaccinated their children, they need to understand the importance and come forward to get vaccinated. Then another priority is that over the last 2-3 years, there have been some newer vaccines that have been introduced, like rotavirus vaccine, pneumococcal conjugate vaccine. So all these are part of routine immunization. So to increase the uptake of these newer vaccines also, which is part of routine immunization, we can increase that coverage during IMI. And as I've already mentioned before, the plan is that once IMI is over, UN will be part of routine immunization only. So that is the plan that the ministry has for our entire country. So in closing, I just want to say that intensified Mission Indradhanush this time will need the enhanced support of all the stakeholders that can help in creating that awareness. It is going to start from 7th of August, and it will run for 6 working days. So the dates have already been decided by the ministry. So in August it's 7th to 12th, September it's 11th to 16th, and October it's 9th to 14th. So basically that's Monday to Saturday of each month. So during these weeks, the districts they have already handpicked several low performing areas. So in these areas, they will be having the intensified mission Indradhanush. Over here, what are the things or what are the steps that we can do to help to spread awareness, especially about IMI that we're talking about. If you can see, this is the poster for IMI that the state has prepared. We have made it very state specific also to ensure that there is a sense of ownership among our own community members also. Through the course of the day, we have seen about what IMI is all about, what are the different issues that we're facing, and what are the different ways we can help us. So just to go back, we want to utilize IMI as a bridge to to fill the immunization gap. We have heard about how the state is doing so much, but then we are still having issues with regard to people coming up for immunization. At the same time, with COVID, we have seen disruption in the regular services. So we have seen that there is a group of children who have partially taken immunization, and at the same time there is a cohort who have not taken any immunization also. So we want to take these three phases of IMI and utilize it in such a way that the immunization gap is filled. So what is the issue that we have seen? In all the different rounds of NFHS, Nagaland is one of the states where we are facing low numbers of immunization coverage. It's not that we are not doing, we are doing our best, but at the same time, other states are also doing better and going ahead. And in all the different phases of NFHS, a group of people where they have partially vaccinated, and there are children who have not taken even one vaccine also. So what is the reason that we see is mostly because due to lack of awareness. Lack of awareness is one of the main issues that we're facing right now when we're trying to reach the last mile population. The other thing is refusal. There is outright refusal also in certain families where they really don't want to take up the vaccination because of some misinformation or some myths and rumor that they might have heard. The other thing that we're seeing is also the AAFI, the fear of adverse events following immunization. I mean, of course, this is, with every vaccination that we see, even during our COVID also, we have seen that there is a small chance of an AAFI occurring, but it is amplified so much that people are very afraid to come for the normal routine immunization activities. So these are some of the things that we're dealing with, especially in terms of fear of AAFI, refusal, and the lack of awareness in the population. And this is where we all can come together to help, allay the fears that is there in the population to ensure that people take up the services that the state is providing. So what are the communication objectives for IMI for this particular round that we're looking into is to create demand for immunization. Like our state officials have mentioned, the services is in place, micro-planning and everything is there. The state is trying our best to provide vaccines and logistics support. But without the community being aware, without the community knowing that there are services that they can take up, there's an imbalance that is created. So the demand generation, the creation of demand generation is very important at this critical phase right now. We also want to look and identify specific communication challenges that certain pocket of population might have. What is the communication challenge for Dimapur might be very different to Kifuri. So the challenges are very specific to district, block, and even to the village level also. As mentioned earlier, we want to position IMI as a bridge to bridge the immunity gap and also move towards measles and rubella elimination. So Nagaland, along with the rest of India, we're committed to eliminating measles and rubella by the end of this year and attain coverage of almost 95% of vaccination. But without awareness and without support from the community, this is something that we won't be able to. We also want to address misinformation and myths that is there in the community. We want to strengthen the network of influencer, the faith-based organization, the civil society organization that is there, and media partners such as you all here. As Kingston has mentioned earlier, we want to create awareness about the ease and utility of the usage of UN and how people can register and use technology to come forward to take up services. And we also want to focus and create innovative outreach, especially in hard-to-reach areas. So what are the different approaches that we are going to be looking into for this particular IMI round is like, we want to use innovative ISC materials like education, information education, communication so that the community is able to take up the services. Community engagement, influencer engagement, collaboration with partnership like as Dr. Sheila has mentioned. Like at the state level and at the district level, we are reaching out to allied departments to ensure that the community platform
that is already pre-existing can be leveraged for IMI. Digital media and with media partners today, like we want to utilize mass and media advocacy and how we all can, help create that awareness. So on this front, I just want to take a few minutes and speak further on like how the media can be instrumental for IMI, by influencing key decision makers in terms of policy level makers and also in terms of like household decision makers. With the positive stories or the awareness or the space that you give us to share our stories out can help the decision makers to read through all the facts and figures that is there and make informed decision about uptake of a positive health behavior. We also want to keep services functioning and accountable as media persons and houses over here. Like when you write about us, about the activities that we do, it keeps us accountable also. It keeps us in check, that the things that we do has to have a certain standard so that people can come up and take the services without feeling a kind of a negative feeling towards it. The third one is like demand generation, as mentioned earlier. Like we are now struggling at the last mile where we are trying to reach out to community for them to come up and take services. As I always mentioned, now our immunization figures are going well. As per our headcount data, we have like good numbers, but we're struggling with the last mile wherein people are, refusing or because of lack of awareness, they are not coming up for services. So this is where like the media can play a very important role in highlighting the services that is there and ensure that demand creation is generated. The next is empowering communities. Why we're saying empowering communities? Because when our people are able to read the right information, when they have the right facts in front of them, they will be able to make a decision, to come up and take that certain decision. So we want to ensure that our communities are empowered to take up that services. Lastly, but not the least, like media plays a very crucial role of providing reliable information, especially when adverse events occur. We are not denying that sometimes AFI does occur, but the way it is highlighted in the media, the way it can be, the narrative that controls it. So we want to ensure that we keep responsible reporting also at the same time, like ensuring all the facts and figures are given out in the right way, and even like during COVID, we've seen like a small myth or like a small rumor can, adversely affect everything that has been planned ahead. So in that way, it is our request also to the media fraternity over here to ensure that we do the right reporting, and also if any fact checking has to be done, you can always reach out to us also. Why we're talking about this also because, is our state, every child is important for us, and we want to ensure that, no child is left behind for immunization. And immunization services are available free of cost at our government health facilities, and they are available even in the private also, but in the government health facilities, we ensure that everything is private, everything is free of cost, and the community has to be made aware that, they can come, take it up to ensure that, their children is protected and cared.